Great, thank you. Just introduce myself. I'm Cheney Nesbitt. I'm the Executive Director, CEO of the Way Station here in town, and I pretty much know every single one of you in this room, so no introductions are needed there. So we're going to go ahead and get started with our program. We do have a Q&A session after each of our researchers and speakers have had an opportunity to speak, so please, as you're listening, think of some questions that you would like to have answered this evening, and we are going to give you that opportunity. So first, I'd like to introduce Dr. Kyle Walsh, the Director of the National Institute of Environmental Health Sciences. Director Walsh.
All right, going to see if my clicker clicks. I was told that if it wasn't on, I shouldn't throw it. No, it says it's on. All right. Nope, that's okay. I don't really need it. But if you want to go ahead and advance on your end, that'll be fine for me, and then we can get it figured out. So let me introduce myself. So I'm Kyle Walsh. I do not work for the EPA. I do not work for the CDC. I work for the NIH, the National Institutes of Health. Within the NIH, there are 27 different institutes. That's why it's the National Institutes of Health and not Institute of Health. And I think I was probably, I don't know, my 5th year on faculty before I figured that out. So one of those institutes is the National Institute of Environmental Health Sciences. And so in October, I took over as the director of the National Institute of Environmental Health Sciences, as well as the U.S. National Toxicology Program, which is an interagency program between CDC, NIH, and FDA that really focuses on sort of toxicology as it pertains to human health and the things that we're all exposed to. If you want to go ahead and do the next slide. All right, so we're going to start with a video message, I believe, from Senator Moreno. Yeah? No? It's not showing up?
This is Senator Bernie Moreno, and I'm so sorry I can't be there with you all today to mark the beginning of this critically important health research program. 3 years after the absolutely terrible derailment that shocked us all, the community has made great strides to heal from the trauma of those days of uncertainty. I remember those days well. When you all had to leave your homes and were uncertain of what your future looked like for your community. When I was in East Palestine last year with our great Vice President J.D. Vance and our EPA Administrator Lee Zeldin, I heard from many of you who have been able to return to your lives but still have lingering questions and concerns about what long-term effects may be in store for those in the community. That's why this program is so critical, and I'm hopeful that the work they will do will help build public trust as you continue to heal from the wounds of that terrible, terrible day. My team and I will continue to be engaged and want to hear from you all along the way. If there's anything I can do or my team can do to be helpful as we continue the pathway to recover East Palestine.
All right. Okay. So let me start by introducing the NIEHS team, none of whom are able to be here today, except for me. So as you may have heard, there is currently a partial government shutdown in place. So all of our team was grounded, which is unfortunate. They are really folks who've been working incredibly hard to get this grant mechanism set up so that it can enable all of the research you'll be hearing about. And so I just want to acknowledge their hard work in doing that. And say that I'm very happy that I was able to find a way to get an exemption to be here with you today. Okay, so what does NIEHS do? Well, I'm not going to read the thing, but we study how the environment impacts human health, human well-being, and we try to do that across the lifespan, right? So when I talk about lifespan, oftentimes people think, oh yeah, from birth to end of life, right? And so we've really been working, and myself in particular, but many, many others, to change that to be looking at health across the lifespan, where that includes gestational exposures, right? So things that babies are experiencing in the womb, and all the way back to even preconception health and how your environment can affect sperm and ova and all of these things, right? And so we want to look at this in this holistic way and try to figure out how we can maximize human well-being. Some items that we have worked on in the last couple of years include this NASM workshop that many of you maybe were able to take a part in. I know some of our research folks were. And so this really focused on short and long-term needs. This is very much sort of a needs assessment approach. We learned a fair amount about the needs. We've also learned in our listening sessions today about many needs that have still been unaddressed that we're looking to help advance and rectify for all of you, okay? Why are we doing a kickoff of funding now, 3 years down the line? That's a good question. So we've actually been funding research in East Palestine, in the community, for a number of years. And so we have funded 6 of these R21 grant mechanisms. This is through our rapid response program. And so instead of going through the typical research review that you submit your grant and then peer review happens 6 months later, and then maybe you get your money 6 months after that, and there's this long extended timeline. These get reviewed as soon as possible. We try to get the money to groups as soon as possible so they can get boots on the ground to really do the important things like, again, the needs assessments, collecting baseline samples, for instance, and trying to figure out what the community needs are. And so we're really, really pleased that 2 of these grants went to the University of Pittsburgh and 1 to the University of Kentucky, who are members of the research team here today. And so today, what we're going to be talking about is this grant that we have funded through something called an other transactions mechanism. Don't need to go into details, but it does allow us some flexibility. And so there has been a $10 million commitment to fund research in and around East Palestine with the community. And this will be lasting for a 5-year period. And so I'm not going to, again, go through all of the pieces. I'll let the researchers talk for themselves. But what we're really here to do over these next few days, and earlier today as well, is listen to you and hear from you. We know that this has been an unsatisfactory response, right? We have some new people involved. We have these fantastic groups who now have funding to work with you, to learn from you, and to hopefully get some answers that you can carry forward so that you have a better sense of self-assurance and can take that back to your community and spread it with all of your neighbors. So I thank you for your time. I'll be around. I'm going to turn it over.
Thank you, Director Walsh. Next up, we're going to hear from our lead PI in this is Dr. Aaron Haynes from the University of Kentucky.
Thank you. Thank you, Cheney, for hosting us, and Misty Allison for helping to organize, and the high school for allowing us to come in through your doors. We really appreciate it. And for everyone who's here on a cold Tuesday, Monday. It's Monday. A cold Monday night. Thank you for coming out. I'm just so glad that we are back and here. I remember being here early in the early days and saying, I'm in this for the long haul. This is not a short time research commitment. This is for the long haul. And I'm so grateful to NIEHS for distributing the money, but also to the federal government for making sure that this money was allocated for you to address your health needs. So my job, I'll say in this, is to do the right thing by you. And the more you can tell me and tell us about your ongoing health concerns, the better we'll be able to do our job. So I'm with the University of Kentucky, but I live in Ohio. I'm a longtime Ohio resident. I grew up in Sardinia, Ohio. Even beyond that, I was Adams County and then Brown, and now I'm in Claremont. And I haven't left, so I'm still an Ohio resident. So I love Ohio. I've been deeply engaged and very passionate about helping Ohioans address environmental health crises. And I worked with Marietta, East Liverpool, and so when this derailment occurred, it was the largest scale environmental crisis I had seen ever in Ohio, and it was like, what can we do to help our residents? That's how I felt. So we launched in. So, oops, all right. So I wanted just to show you where the participants were when we started, and we now have about 400 in the study that we have been, we've been following and tracking health. We called it the health tracking study. And I want to call out Tim Hilbert, who was with me in the very beginning. Thank you, Tim. We were already busy doing Marietta and East Liverpool work. And then all of a sudden, this occurred. It was like, all right, clear the plate. This is major. We have to do something for this community. So even though we had our hands full with other NIEHS funding and doing work, we really pivoted and really devoted a lot of thought and mental effort to figuring out what's the best course of action. So one thing that we did was track health symptoms. I was seeing a lot of, or hearing reports about health conditions, and I was like, this needs to be documented. So we asked residents to complete a survey, and this is only like one question that, one of the many questions, and it was some of the health symptoms that they've been reporting. And you can see on the slide, and maybe you'll say, yeah, I've had that, upper respiratory, rashes, nausea, vomiting, bloody noses in children, which we learned from. We had an open-ended question, and we said, tell us anything else you think we should know. And we started seeing some of the female participants reporting menstrual cycle issues, and it's like, this is important to add. So we responded to that, added it in our survey, and then began seeing it wasn't just one woman, it was many. So we've designed this next phase of research using this data, and today we listened to more residents and heard about more ongoing concerns, and so already we're revising the questions and what we're going to be doing in the future based on your input. So I know, thank you, Chin, you said questions, but actually if you can even just tell us what you're experiencing or what you've heard others, we would really appreciate that. We have a fact sheet in the back of the space, and my phone number is directly on that bottom. So if you don't feel comfortable even tonight, you can just call and leave a message. So one of the other health conditions that we've been mainly focusing on is stress, and you've heard about the trauma. We looked at, there's a screening tool that other communities have, that has been used for other circumstances to screen for post-traumatic stress disorder. So the rate of PTSD screening, this is not a doctor diagnosis, this is a screening, but I'm gonna say it's very high. Is that in, what's that number, 40%-ish, and then it got dropped a little bit down. But in comparison, we looked at individuals who were community members when the World Trade Center went down. And that was a major trauma. But their percentages were about 19%, so even years later. So we think this is, what you experienced was a major trauma. And we know that also trauma can affect every organ of the body. It's not just isolated to what thoughts that you have in your mind. It can affect your whole body system. So we've taken that approach and began creating studies, I'm gonna say multiple studies within this, to address those health outcomes. Okay, so here is the health research study, and I just want to give you an overview, and if the members of the team are in the audience, they can shout out and wave, and they're here because then you can ask them specific questions. All right, so we're going to focus on these major body organs, respiratory, cardiovascular, mental health and wellness, reproductive, menstrual health, function, and kidney, liver and kidney function. But that's not my team. We're gonna, University of Pittsburgh is working with us on that component. All right, you know what? I should be seeing these slides too because I can't remember what I said. Oh yeah, I wanted to tell you who is eligible. I think that's what the slide is. So we're open to, when we first launched, it was all adults. But now we have heard so much about children, and children are so important to us. I have 3 of my own and can only imagine. So we're extending this to children ages 8 and up, and we have very specific measures for children. And even the parents of those children, we're going to ask, I know whoever signs their kids up or has their kids do it will have extra questions to answer. But we're taking a very sensitive and conscientious approach to working with children in this study also. So, and we also have a community in Cambridge, Ohio. So one of the key pieces here is that it's how do we, at the end of the day, are we able to associate or say, yes, this is happening in East Palestine and this is an issue. And one way that we can do that, we can do it many ways. One way is having a comparison community. And we've heard ideas today about what that comparison could be, and I think those are great avenues to pursue. And what we've started with, our thinking is, we found a comparison community in Ohio, Appalachian, Cambridge, Ohio, which is in Guernsey County. So we're going to invite them, and out of the goodness of their heart, they will sign up and join the study so that they can be a comparison for you. We also really want to focus on the workers, those who were first responders, those who were at that event. And maybe they don't live here any longer. Maybe they came in just for the event and left. But we want to include them as well because we believe that exposure, even at that short amount of time, could have lasting effects. So that's the group that we're focusing on. And we want families. It would be fantastic if a family came in all together, took the surveys together, and then we could just have a more comprehensive view of the impact on a family. Okay, so this is just some visuals. This is our website. And because I can't go over everything in this short amount of time, but on the fact sheet that we have, there's the QR code. You can go to the webpage. If you put your name and address in now, we'll eventually, as soon as the survey is ready to go, we'll email you and say, all right, we're all ready. Now you can jump in and take the questionnaire. And this is a voluntary project. There's all research, you have to consent, and it's your choice. We are providing a nominal amount of funding for you because we know it takes your time and we value your time. So for anyone who does the survey, it's $25. If you do the health clinic portion, which is a partnership here with the East Palestine Health Clinic, there's $100, up to $150, depending if you can come back for a liver screen. Okay. We are one of the, it's anytime you do research within a community, it's very important to work, I think, within the local infrastructure. And the Way Station has been a magnificent support network for the community, and there was no clearer choice for how should we administer and work this study into your fabric of your town than to work with the Way Station. And we're just so happy that they've allowed us to have space. We actually have a study space there. And if you don't want to take the survey at home, or you can always go to the Way Station. We have room for you there. Okay, and if you wanted to check out the webpage now and didn't grab a fact sheet, you could scan the QR code. I want to make it very easy for you. All right. The other partners that we have are the East Liverpool City Hospital, the clinic here in town. We're working with them very closely and going to be working with their staff and full training. It's not your standard typical care. We have different measures that they're going to be administering. And it's going to take some training, but it's going to be wonderful. And we're looking forward to working with them. And then also Muskingum Valley Health Center in the Cambridge area. Okay, so I wanted to show you some of the key people from our team that's like usually behind the scenes and making it all work. So Tim Hilbert is here, he can say hi. Dawn Bryant is here, she's made our webpage. It takes a lot, it takes a village to make a study, lift it up off the ground and administer it. So I wanted you to see some of the faces that are part of this. And these team members, we've been thinking about you and your health for a long time, and we're just so glad we have now the financial ability to be able to take action on those thoughts that we've had. Okay, next page. All right, we have always been guided by your voice. And very early days, we formed a community advisory board, and I wanted you to see their names and faces, and you know them, and they're wonderful people. Some are here. And so if maybe you don't want to contact us directly, but you want to go to an advisory board member, please do. They're your friendly neighborhood research partner in this. And we have, everything that we've done has been vetted by these individuals, our communication back, and everything's been super beneficial. Everything's been reworked and done based on their feedback. So I can't stress the importance of having these wonderful people a part of our team. Okay, so we also have, new to this round, this new phase, this new expansion, we formed a clinical and public health task force. And we did that because we saw and kept hearing about a disconnect, a non-connection between the public health workforce going to your physician, hearing, and then you having an issue, and there just being some kind of a disconnect. Or the healthcare providers wanting to do something, not knowing exactly what to do. So we wanted to be informed by them on how can we best interact with you. How can we make this research that we're finding not sit on a table, not sit on a desk or in some library, in a library, which is all good, but how can we put it into action? So this group is going to help us inform the way to do that the best. And I'm looking forward, we've met now once, we're going to meet again in person tomorrow, and they're a fantastic group of people. Okay, again, it takes a village. So I can't do this. We cannot do this work alone. There's too many health concerns. And when you go to school and you learn, usually you develop an expertise. Well, the health concerns that I've been hearing and we've been considering, it's really broad. You have a lot of issues we need to tackle. So we created a scientific advisory board from researchers across the United States to use their intellect to help us do a better job. So I want the community feedback, but I also am looking at the science so that we use the best technology, we use the best biomarkers, we use the best, everything that can be done at the highest level, we want to bring to you. And this scientific advisory board can help. And you can see, hopefully you can see where they're coming from. We have Mount Sinai in New York, Cincinnati Children's Hospital. One of our advisory board members is here in the front, yes, from the Ohio State University, Daryl Hood. Thank you. One of these physicians is Dr. Nicholas Newman. He's at the bottom, and he was part of the team that was on the other end of the phone when residents here called the Poison Control Center. So he's very aware of the situation, and I'm so glad to have him on this group. Okay, so I just want to show you a little bit of what we're planning. All right, respiratory health. We're going to do very targeted adult surveys that are validated measures that have been used across the U.S. We're going to use measures that have been very focused on children. So children will get their own survey, and parents, again, will have to help. We're going to do in the clinic, a measure of lung function. And that test is called spirometry. So the staff there will be trained and know how to do it. We have a world-class expert in spirometry, and Dr. Roy McKay he's from the University of Cincinnati, and that's how I first met him. And he's world-class. And we're going to have our team trained by him. And that's going to happen at the end of March. And these two team members weren't able to make it tonight, but Dr. Radha Choate and Dr. Mark Worth are going to be my point people for these tests. All right, cardiovascular health. We're going to do some standard things, and you might think, oh, that's boring and run-of-the-mill, blood pressure, heart rate. But these are all good clinical measures that we'll be able to follow and keep long-term. Heart rate, height and weight. We're going to do a waist circumference, and then like a body composition. And then we're going to measure something a little different, which is arterial stiffness. So it's and the artery in your neck, and then we'll see how thick that gets. There are changes in that based on the pressure of the blood going through it. So it can be indicative of things. So we're going to do our best there with cardiovascular function. And then if we see something more, and it's like, oh, we need to do something more, we'll figure that out and keep exploring. And Dr. Beth Lacey in our College of Public Health is leading that. Okay, next, mental health. And this is a very important one, and I wanted to show you the names of all of the surveys that we've pulled together. This is quite an exhaustive list. So when you join the study and you're asked all these mental health questions, I wanted to show you, they're from an NIH, this toolbox, this toolkit. Many researchers across the U.S. use them, so we can also compare to other studies. We can look at East Palestine residents compared to others across the U.S., and then also in Cambridge, of course. So we have quite a few measures specific for adults and for children. And then stress can also come across not just in how you respond to questions, but you can measure it as a chemical in your body. So we're going to measure stress in your body by having a hair sample, and we're going to measure, it's called cortisol. Cortisol, and then there's the hormone component to that, which is cortisone. And both of those are going to be measured at one of our partnering institutions, Mount Sinai Medical Hospital. And they've been a great partner with me doing research for many years. And so I'm really glad to keep them in this loop. And Dr. Tess Thomas is leading this. She's worked with mainly children's studies for years. Okay, so we have built quite a team for reproductive health and menstrual health. So we have Dr. Catherine Hartman in this space. Yes, we're very fortunate to have her. She was formerly at Vanderbilt and just came to the University of Kentucky in Lexington, and I'm just so glad we can just grab a hold of her expertise here and apply it to East Palestine's issues. So we're going to look at we're going to start with the females and asking more specific questions on period irregularity. Are they too long, short? What are you noticing? And then we're going to do a pilot study on a few of them just to see if we need to go further and look at some measures that you can measure in the body. So some of these small pieces, I just want to explain why we would do it on a pilot level or a small subsample, is because if there is something there, then we'll reutilize money and invest it in that component. But if nothing comes up, it's like, okay, that's not the topic we need to go to. We can redirect our path and steer it to the most pressing issues. So this is going to be a pilot. And we have 3 fabulous researchers, and Dr. Anne Marie Jukic is at the NIHS, and Pat Hannon is with us at UK. All right, cancer. So this is the big one. And we really rounded up a team for this one. We have, at the University of Kentucky, there's the Markey Cancer Research Center. And it's a wonderful research center. They've got national comprehensive cancer care. And we have a team now that is going to be looking at the cancer diagnoses in the survey. We're going to start collecting this. Now, I've heard that some cancers are starting, to pop up, and it's like, is it connected to the derailment? Is it? That's the question. And the more people that give us information, if they have something or not having anything, it's going to add value and help our interpretation and know if there truly is a connection or not. So we really need as many people as possible to join so we can look at cancer diagnoses. All right. Oh, wait, one more person. Sasha Jakubek is in the space. I didn't call her out. Yes, and Jay Christian. Yes, was geospatial. Thank you. Sorry. This is hard at an angle. All right. So we're going to collect a lot of information on you. And you could see what do we do with it? It's a ton of numbers and yes and no questions, et cetera. Well, so you have to build a strong analysis team, those who are going to take all of this information and work with us and the full team to analyze the data and start looking and looking at patterns, at relationships, at trends, and then ultimately associations. So we are going to be looking at all of those health outcomes. We're also going to be looking at state level data. So we're going to work with our partnerships. We're building a partnership with the State of Ohio Health Department and the Pennsylvania State Health Department to acquire the data that they already collect on Ohio and Pennsylvania in the areas, and then look at that data, health outcomes, before the derailment occurred and then after. I think that's really important, and I'm excited to do that state level data analysis. And then geospatially, where do these people live? Where do people live that are getting these diagnoses, et cetera? We're going to do geospatial analysis. So where do they live? Did they move? We have a lot of still questions that we need to answer. I know many people evacuated, left, and did not come back. Or they did move back, or they came back periodically. So we hope to be able to capture all of that and do some really nice geospatial analysis. And Dr. Jay Christian, again, wave, is leading that. All right, I think we're almost done. So the other component, we're going to collect blood. And one of the main reasons I've been excited about doing this part is to look, when I hear about a lot of the outcomes, the rashes, maybe more allergies or more respiratory issues, I'm thinking that the immune system, the immune system could be impacted. And so it could be altered in a way that perhaps you're more susceptible to things like you hadn't been. It's a question. And so we built a team and really focused on immune function. So we're going to collect a blood sample, and there's a ton of processing that goes with it, but these samples will be shipped overnight back to the university and then managed in a laboratory for analysis and looking at the immune function of residents, and then connecting that data with all of the other health things like respiratory, et cetera. We're going to tie it all together. And we have a great team. They couldn't come tonight. So I've just a little sneak peek. I know the University of Pittsburgh's coming up here in a moment, but a part of the health clinic team is the liver and thyroid function. And I just wanted to give a shout. Dr. Juliana Baer is going to present soon. Okay, and now she's presenting right now. Did you want to introduce her or just keep her rolling? Yes, Julianne Baer. And the clicker works.
Thank you. Yeah, I think that was a fantastic introduction. So I want to start with, some of you may know me already. We have had boots on the ground for the last couple of years due to what Dr. Walsh was saying earlier, the R21, and we have been looking at liver function in the area. We have listened to all of you because the entire community has told us they want us to also look into thyroid function. So this is one of the things that we have taken on. And I want to also say, one of the nice things about the R21s were we were all working together, but on the other hand, we were still separate studies. Now the new thing is we are one study. So all of the things that we do, especially with Dr. Haynes, we're doing this together. So you don't have to come twice, and there's a caveat to it, and I get to it in a little bit, but this is all one study. It's just conducted by two different universities. So one of the things that experience here in East Palestine taught me as well is that I, in the past, haven't given enough background on liver disease. We've heard this a few times today in our listening sessions, that a lot of people said, oh, I feel fine, I don't have any symptoms. But here's the thing about liver disease. Liver disease is a silent disease, and you will not have symptoms unless you're in a late stage. And this is not to scare you, it's just to give you perspective and background. So liver disease has several stages, and the first couple, Does this have a pointer as well? Yeah. So the first few stages of liver disease, the early disease stages, are reversible. However, the further you go, you will have like fibrosis and cirrhosis, you will have some scarring to the liver. And as you know, with the skin, scars don't typically disappear. So at some point, liver disease becomes irreversible. And we know of a few major factors that cause liver disease, like constant alcohol misuse, obesity, and like high concentrations toxic chemicals. We know this for decades that these cause liver disease. But one of the concerns that came up within the last, let's say, 10, 15 years, or really strongly came up within the last 10, 15 years, is that environmental chemicals that are at lower concentrations in the environment can enhance disease stage. And that increases inter-individual risk, because not everybody that, let's say, misuses alcohol on a daily basis will develop the late stages. And we still, to this point, don't know why. And there's this mainly hypothesis that environmental chemicals may basically tilt the balance over to the later stages. And then the other thing, as I said, we are also now focusing on thyroid disease, and, or thyroid dysfunction, rather. And thyroid dysfunction is affected by the same stressors that the liver is. So alcohol, obesity, and environmental chemicals. And I'm sure there's also a few others, but those are the major ones. And then one of the things that we came across in our studies recently is that it's more of a recent event that we are understanding that thyroid dysfunction and liver disease are really affecting each other. This is like a bidirectional situation that if you have thyroid dysfunction, that may influence the degree of your liver disease and the other way around as well. So it's a really important part of our new studies. And of course, this is all also driven by environmental chemicals. And then what are the effects? In both of these cases, we see, for example, in the thyroid, we see changes to hormone synthesis and transport, but also to hormone metabolism. But at the same time, liver metabolism is affected as well. And this causes overall in both organs inflammation and therefore damage. And again, this is bidirectional and may potentiate. So, you're right, this is hard at an angle. So why do we do this? So the reason we have been focusing historically on liver disease is the liver takes one for the team. So the liver is the major detoxifying organ of the body. So it will take all the toxicants that you inhale, ingest, or anything that come into your body, they will go straight to the liver. And then the liver will try to process it out and eliminate it. And in that process, the liver may get damaged. And similar with the thyroid, it's not that the thyroid detoxifies, but some of these chemicals that we all are exposed to, and especially here in East Palestine potentially, these may mimic hormones that come from the thyroid or affect the thyroid. So this again also changes the production, the transport, and the metabolism. So this is why we're doing this, and really want to focus on these two organs. And so here is, and yeah, I'm not going to go through the details of this list, but this is a list of blood tests that we want to do. So what do we want to do? Slide one is the blood tests. And with this, again, you don't have to come back for these blood tests. This is the same day that you would come if you wanted to participate in the other part of the studies. It's the same blood draw. And what we really like, and we've done this over the last couple of years already, we are doing this here, the blood draws here in East Palestine. You don't have to travel to Pitt or anything. We will do it here. And then the other part of this, what I really need to say about this as well, with this part, with the liver part and the thyroid part, the samples will actually also be analyzed in East Palestine. So we will still continue to work with the clinic here. They will do this for us and will give us the results, and then we will report them back to you, because that was one of the things that came up during the listening sessions today as well, and in the past also. And we've been doing this over the last few years already. We will send out letters that have the standards that we're looking at, that would be the range of normal, and then we explain why your potential results are either normal or outside of the normal range. And we will have phone numbers with clinics that can actually help you on the follow-up on this. Then the other part of our study is non-invasive, which is nice. So we are working with a UPMC-owned device. It's mobile. We bring this 1 or 2 times a week. We've been actually doing it since April. Dr. Okonkwo over there, he's been doing these. It's an ultrasound-based technique that will measure liver stiffness. And liver stiffness is an index similar to what Dr. Haynes was saying earlier on the, was it arterial stiffness? Like, it'll tell you things about the progression of your liver disease. So the earlier stages of liver disease, you will have fat in your liver, and of course you can imagine that comes out different in a stiffness reading. And same with the later results of the scarring of the liver. So we can all do this with this nice device that we can bring here a couple of times per week. So those are the events where you would potentially, if you would participate, have to come back. I mean, there is the possibility as well that we can do it on the same day as the blood draws, but you have to be fasted for this. And there would be another $50 for this particular measurement, no matter if it's the same day or another day. And then, who are we doing this with? And this is basically the same, and I don't necessarily need to repeat it. This is, as I said, we are the same study. It's the same things as with the UK study. So for blood, it's children 8 and up, and of course adults. And for the FibroScan, unfortunately, with younger children that are smaller, we can't do, so we are having a cutoff of 15 years of age just because of the size. Otherwise, the probe, the ultrasound probe won't measure correctly, the length of the path that it goes to the liver. And with that, that's just really our team. So of course, we are still with the UK team. This is really the PIT study. This is part of my lab, and Dr. Okonkwo in the back here. As I said, some of you know him. And then we have Dr. Hood, who is a consultant. He's part of my team, but he's also really part of the overall team. And with that, I'm happy to hand over to Yale.
I just wanted to say one thing with the QR codes. My mother couldn't do it if her life depended on it. So one of the great things about partnering with the Way Station is that we are going to have people in the building that are going to be able to help you, walk you through that whole process of any survey. And just to be very clear that Dr. Bear meant $50, another $50, she meant that's an incentive to you, nothing that you have to pay to get it done. It's okay, I'm picking them up when you're dropping them. So let me introduce from Yale, Dr. Nicole Diesel and Dr. Michelle Bell.
Okay, good evening, everyone. I'm Nicole Diesel from Yale University, and along with my colleague, Michelle Bell, we are leading the Yale project, the Water Research Project, and we're really grateful to be part of this overall research program. And our Yale team, we may be from Connecticut, but we have spent a lot of time here in Ohio and Pennsylvania. For the last 10 years, we've been doing deep community engaged research, looking at drinking water quality issues in Ohio, Pennsylvania, West Virginia, and the surrounding areas. So today, I'll tell you a little bit about why we're doing this water research project, who we are, and what the project will involve. So why focus on the water? Well, this project is directly in response to numerous concerns that we've heard from many conversations with residents. Many of those points were echoed today in some of our listening sessions. People had concerns about the water quality then, and still have concerns about the safety of their drinking water for themselves and their families and their pets. There's some concerns that even though a lot of testing has been done, there are still questions about whether these tests were collected in the right place, at the right time, and for the right chemicals. For example, there's been a lot of focus on vinyl chloride, but people are wondering if the breakdown products for that chemical have also been tested. And also concerns that maybe testing hasn't covered a large enough area, that areas beyond just the derailment and evacuation zones could potentially be impacted, and they'd like more information. So again, we are focusing on water to try to address some of your concerns about the water, and recognizing that although the plume has dispersed, we are a few years later, that impacts to the drinking water could continue. There's still questions about whether this could be happening. So we really aim to address these gaps and try to answer some of your questions, including trying to reconstruct information in places where maybe there weren't monitoring data available. And here is our research team. We have a group of people with different backgrounds and different expertise. I'm an expert in exposure to environmental chemicals. My colleague, Michelle Bell, has expertise in epidemiology and biostatistics. We work closely with Jim Sayers, who's a hydrogeologist, who's going to be taking the lead on this state-of-the-art water model that Michelle's going to tell you about. And we are really grateful for the many community residents and partners that we've been working with, and we have two community members directly embedded in our research project, Jill Hunkler and Stuart Day, who are both here, who live in the area and work in various jobs and are also podcasters and storytellers advocating for their neighbors.
Thanks, Nicole. So thank you again for the opportunity to share with you. I've really enjoyed the community conversations today, and I look forward to your questions. So I want to tell you more details about what specifically we're going to be doing with the Yale Water Study, and we have two components. One is a community survey, where we're going to hear from residents a little bit about their concerns about water, and also we're going to do a state-of-the-science hydrologic model. So let me tell you a little bit about each of those, starting with the community survey. So this survey will ask you, and anyone can participate, about what kind of things they've observed with water. Have you observed changes in the water? This can be visual, this can be taste, and we're really interested in both if you have and if you haven't, to get that comparison. We want to know your perspectives of water safety. Do you feel safe drinking the water, bathing in the water, feeding it to your pets, giving it to your children to drink, and so on? Are there certain chemicals that you have a strong interest in? And we've heard today that there are definitely certain contaminants that people are very interested in. Some of those have been studied less than others. Are there particular locations that you're concerned about? We heard that some people were concerned about locations that have undergone very little testing comparatively. We'd like to know your drinking water behavior. How much water are you drinking? What kind of water are you drinking? And more. And there will be opportunity in the survey for you to share things that maybe we didn't even think to ask about. So we've developed a pilot survey in coordination with our community partners. We're going to make some minor modifications to it based on the community conversations today. And this will be available online and on paper, so you don't have to do the QR code if you're like Cheney's mom or me. I struggle with those too. And it's going to be for residents who are living in areas near the derailment, defined broadly, And the survey is for people 18 and older, so we want adults filling out the survey, but there will be the opportunity on the survey to answer questions about your concerns for children as well. So children are involved in our concept. We will have adults filling out the survey. And we're hoping to launch this within a month. Now for the water quality, I want to start with what do we wish we could do? Well, what we wish we could do is measure everywhere at every time for every chemical that you want, including back in time, including before the derailment, so we have a comparison. But both for logistical reasons and resource reasons, we can't do that. So what can we do? Well, what we can do is perform a state-of-the-art hydrological model. And one of the big strengths of this model is it will provide information everywhere in the study domain, not just at particular places that are monitored. So this figure we have here is just a hypothetical figure, but imagine if we could map this over your neighborhood. So we have a sign of contamination, and then we have the water flow, which flows differently from air. And just what we wanted to demonstrate with this figure is that you can have an area that has some level of contamination that's quite far from the actual derailment site, and could even have higher contamination than some areas that are closer to the derailment site. And we've heard this from a lot of community residents, that they were told, oh, you must not be having problems, you live pretty far. For water, that's definitely not true. And so the community residents are correct that you can have these problems, and that's something we're going to want to get at. So we are going to estimate with this model the vulnerability, and what we mean by that is for every location we'll be able to say this area has a high probability that there's a vulnerability to water contamination, and for other areas we'll be able to say there's a very low probability that this area has contamination. So what can we learn from these studies? So from the community survey, we can learn about your priorities, and this is going to be beneficial in a lot of ways. First is, as much as we can, we're going to incorporate that information into our hydrologic model in terms of what chemicals do we incorporate, in terms of what locations to make sure to include. There may be some things that you've experienced that we haven't thought of, and so on. And then we also are going to give this information back to you. It's anonymous, but in the aggregate, I'm sure many of you would be interested to see a documentation of whether or not your experiences match those of your neighbors, and we're hoping that this can help prioritize future efforts. And then for the water model, it will also be made publicly available, and we're hoping that this can guide community members, leaders, government officials, and so on what areas to prioritize. So if it was me, and I saw that there was an area that had a high probability of vulnerability to water contamination, I would hope that that area would be prioritized for monitoring, for additional testing, for perhaps other interventions, and so on. We are hoping to be able to distinguish the impact from the derailment from other sources of water contamination. And this is something we heard over and over in the conversations with community members, is that they really want to know, is this a problem from the derailment, or was this just a problem from something else, like industry or something else? And so we'll have those maps of vulnerability, and then also we're hoping that this information can feed back into exposure assessments and health studies, depending on what resources are available for the future, and what we find. And so for that, I want to thank all of you for coming and giving us the opportunity to share our plans for the water project with you, and we really look forward to working with you and to your questions. Thank you.
Okay, so thank you everyone who spoke tonight. So now is, like she said, it's not necessarily questions and answers. It's an opportunity for us to hear from you. Specifically, if you are experiencing any kind of symptoms, if you know of somebody who's experiencing any kind of symptoms, please share that if you haven't already done that in one of our listening sessions that we had today. But if you do have questions, now's the time to do it. We'll do this for about a half an hour, or as much time as we need. And then we have a brief documentary that we do want to share with you. It'll take about 10 minutes, so I'm hoping that you guys will stay. We are videoing this, so we are going to have a volunteer is going to go around with the microphone. So if you could, please speak your questions into the microphone, and that way we can make sure we hear it. And then somebody from down here, not me, will be happy to answer any questions. Got it. Yep. I said yes, but I don't know if we can. Of course we can.
Hi, my name is Bud. I'm speaking for my son who is now in a hospice house in Youngstown. He has stage 4 brain cancer, and he's got lesions on the brain. What's it called? Metastatic, so it means it's coming from someplace else in his body and ending up in his brain. Unfortunately, he's only going to be around for a few more days. The symptoms started with the brain lesions the first in November. He went and had an MRI the 22nd of November. The doctor read him and on a Thursday, called him Friday to come in and talk to him about these brain lesions. Then he went to the cancer doctor on Monday and has been going to doctors ever since. They never found the source of the cancer. He would like to know where that's coming from, and so would I. He worked with PVC a lot in his life. Before the train derailment, he was fine working with it. Did it real good. He's a cabinet maker, did a lot of great work. But right after the derailment, he had a big job he started with the PVC trim. He cut a few pieces and got a real bad headache. He wasn't able to work with it after that. Since then, he's been doing a lot of work on his house. He lives 432 yards away from the derailment. So I don't know what I'm doing, but we're thinking the PVC particles in the ground. He did a lot of excavating by hand. He did a lot of beautiful work in his front yard and his backyard. He got that all done. And this all started, and it just kept getting worse and worse and worse. He lost the use of his right hand and right leg and part of his face and mouth. He had trouble talking. Of course, he's right-handed. He couldn't work anymore. Where he works, his boss is really nice and give him his pay like he was still there. But it just happened so fast, we weren't able to get anything done. He got his will made and all that. That's all done. But because his insurance is what they call non-affordable insurance that covers hardly anything and costs a lot of money per month. But right now, he has a lot of course, health, medical bills that have to be paid. Unfortunately, he has enough money to do that, but it's going to take most everything he's saved up. But of course, where he's going, he won't need it. But I just think there ought to be some research done on the ground, because that's what he worked around most of the time was that. He would like, and our family would like to know where this started. Where are these PVC particles that's all in our ground causing a problem? I mean, he worked with it before. He couldn't work with it afterwards. I just think this ought to be addressed. The ground ought to be excavated in terms of what's in the ground. What are these PVC particles causing? I think with him it caused a big problem. And unfortunately, he's losing his life. He would have been 65 in August, or he will be, but he won't make it. And of course, he don't have good insurance. But I don't know what else to say, just that he would like to know where this came from, and I would like to know. Thank you for listening.
but I wish I had an answer for you right now. But thank you for sharing that. It just breaks our hearts. So I heard you ask was soil testing? Is that, you said in the ground. Did I want to interpret that right? Yep, yep. Yep. Yep, okay. Yep.
Be off work, and luckily his boss had a family. But that's ending up now in a hospice house.
Wow, you're brave to come even tonight. You're very brave just to even come. Thank you. When you could be spending time with him.
Something needs to be done.
Yes,
People need to know,
yes,
they need to know, get better insurance,
yep,
because they're gonna be end up paying it out.
yep. Thank you so much for sharing. And we will see what we can do. We have maybe some possibilities of additional soil sampling, and we'll see what this sounds. Thank you. Yes, I appreciate that. I'd be asking the same thing. Wow. Yeah. Oh. Sorry. Yep. Did you have a comment?
So part of our R21 study was that we took some soil samples. This is not, so as I was talking about, I'm just mostly doing health, but I had a team member that did indoor air, indoor water, and then garden soil sampling. And so unfortunately, that's a very small team, and we had limited funds, so there's only one person analyzing the data. So they prioritized the indoor air and the indoor water. The soil samples we still have at the University of Pittsburgh, and they will be analyzed and there will be answers. I am not sure if those will be the answers that you are looking for, that we all are looking for, but what I wanted to make sure is that you're being assured that we are actually doing those. Unfortunately, limited. I don't know the answer to that. I'm sorry. Yes. Yes. Thank you for speaking up today.
Yeah, so there's cancer registries in each state. So Ohio has a registry, and I know Kentucky would save biopsied pieces like of lung, et cetera. I don't know if Ohio does, but we could find out and see if that's an option for you. Because as you were talking, I was like, yeah, that could be interesting to collect. Oh, sorry. Thank you. Any other thoughts, comments, questions? It might be hard in this big public space. Oh, good, there's one.
Oh, yeah.
Did you hear that, bud?
I was an auctioneer. Yeah, I got a couple quick questions. I'm from Boardman, and I got a degree in environmental compliance, then with hazardous waste, health physics, then with radiation protection, minor in public administration. I cleaned up hazardous waste sites for a short time and seen all kinds of crazy, stuff on those hazardous waste sites. I was like at Brooklyn or Brookhaven National Laboratory, cleaned that place up. I was at 3 Mile Island, a bunch of other places. And a lot of things that I seen go on that week. I was at home taking care of my mom. I locked her in the house for a week because I knew what was happening. They said that plume was a mile or whatever, but it hits states. You know what I mean? So my concern is not just in East Palestine, but the water sampling in all these other places, like Mahoney County. Are you going to do that? The other question is the sampling for the blood with the dioxins. That's one of my major concerns. Are you going to do that for that? The other thing is, instead of sitting around watching people, whether they have cancer or not,
Are you going to have detox programs to be able to detox the livers before they get the cancer? That's another question. Another question is the military involved with any of this situation going on? There was a military guy there with the wine. All the sites I've been to, I've never seen anybody with the military. So is the military involved with any of this situation, with the testing? The other thing, as far as you say, there's limited resources. There's all kinds of resources. You know what I mean? If, with the wine and, the government, you could have $1 billion right here testing everything if you have the right leverage in doing it. As far as this program here with, all these scientists, you have anybody from the public monitoring this, being able to attend these meetings that you're having, that kind of stuff. That's about it for right now. I'm looking at running for governor right now, so I would like to sit on that panel, you know what I mean? Because I have the ability to see a lot of this stuff go on and to be able to have a little check and bounce, on that. And with that, I pass.
Okay, I'm going to take you up on that offer to meet with us and get involved. I'm happy to have that happen. You asked about the military. In the terms of the response, I don't know if they were. I know that they are not involved in any of our research studies. No, gotten confirmation on that. So, no, would you recommend that they are, or how?
Yeah, no, I was curious if they are, okay?
No.
Just to see if they had anything going on, you know what I mean, monitoring
Similar.
the situation, because there was somebody from the military
Oh.
with the wine, during this
I don't know.
process, whether they blew that tanker up to,
Yeah,
try to open the tracks faster,
Yeah.
that kind of stuff. Because I've never seen, in the people that I've, worked with, when the tanker, this kind of situation happened, they just go pump it out. You know what I mean? I know they were talking about it was overheating and stuff, and then they came back and said that, no, they could have pumped it out. So, was that the case, that they had to get the tracks open to get, military equipment down the track to Ukraine or something like that?
Yeah.
So that was my concern, that, once this stuff is, you guys are doing all the research and everything,
Yep.
are they going to have a hand in this, to make sure that the information is legit? That's all.
Yeah.
Not
All
that I
right.
don't trust the military.
No, I'm glad you brought that part up, because that's been a topic. And I want to talk about confidentiality of you, let's say participants, anyone who's in. We are by law, and we have a NIH has a certificate of confidentiality, which gives us the right to never share your personal identifying information, ever. No matter if it's government, no one can touch that information. So would they have a hand in knowing who participated? Absolutely not. No one will ever know except us, and we always de-identify pretty soon, right off the bat. We give everybody an ID number, so we're not, we won't even see names very often. However, when we report your data back to you, we'll have your name and address so we can send you personal information. And I'm going to just reiterate what Dr. Walsh said. We are not CDC. We're not EPA. No federal agency or any other agency, including law firms, et cetera, have any influence on anything that we do or anything that we report or any of our data interpretation. So that's the one, I must say, the beauty of working with academics. There's some drawbacks, and I'm not shy about talking about them, but the benefit is that we're independent from any of that influence. So what the data say is what we will come back and communicate to you. And I will be sharing preliminary, like, okay, we're finding this with our advisory groups. We've done that before. And they've helped us to actually help interpret that data information and then determine the best ways to share it with the public. Does that answer you a little bit?
Yeah, another question with the baseline. Normally when you go into a hazardous waste site or get in a field, you take a baseline.
Yeah.
Testing of, blood, stuff like that. So with everybody that is participating in this, are you going to go back to any blood work previous in their records to be able to have a baseline of where they were at and then analyze that and then see after the spill what went on?
Yeah,
along
so-
those lines. And
yeah.
one other question. At the same time the situation went on, this whole vaccine with the COVID thing erupted. And now, starting to see all kinds of, the whole fight with vaccines and stuff like that, and vaccine injuries. Are they going to, look at this person got vaccinated, this other person did not? Is there any affiliation that the vaccines may have been causing something also, or along with it? So do you have anybody looking at that situation along with the chemicals itself?
You know what, that's a very good point, and maybe we should. We've not looked at we don't have it currently in our questionnaire about any vaccinations. There's shingles vaccination, flu, COVID, lots of vaccinations. And we've not included that part of our survey yet. So we, at the present, won't even have that information. We are thinking and going to have individuals consent, if they want, to working with their healthcare provider, and if they want us, we would love to have it, because it would be very informative, like you said, to have your medical records from prior to the derailment, and then we can add it going forward. We would absolutely love to do that. But that would take another, consent from you.
Right. And one of the reasons I say that is because there's, with the vaccine, there was a government hearing with Ron Johnson, and they had the, vaccine hearings.
Yep.
And one of the ladies stated in there that the COVID vaccine was killing off good bacteria in the intestinal tract. And so that has not been publicized as it should be,
Yeah.
if that's the case. Okay, so if you have people getting these vaccines and they're killing off the good bacteria in the system,
Yeah.
is that a cause of some of this stuff? So they get exposed to this train derailment. Next thing you know, they get a vaccine. It kills off the good bacteria. They can't fight the situation going on in their body. So that's where I'm coming with that on, you know
Yeah,
what I mean, with the vaccine correlation.
Yep, good questions, and we haven't included any vaccinations yet, but maybe we ought to at this point. Yep,
Okay, thanks.
that's a good point. You asked about dioxin too. I'm having a little bit of a good memory right now, thinking of your other 10 questions you had.
Yeah, I got a lot of them.
You had a lot. I love it. Dioxin. You asked about that. That's a very good question. So early on, it was July of 23. We knew that there were a lot of questions around dioxin, and so we had already launched this, health survey, and we had people living very close. So we invited about 20 people to come and have their blood drawn, mainly specifically for dioxin. And we'd never done that before, but we expanded our repertoire. But we had the samples analyzed, and all of the values were compared, because you have to compare it by age, how old you are, because dioxins they're in my body, they're in all of us. We've all been exposed, even burning firewood, you'll have dioxins in your body. But it turns out to be like which dioxins, which ones, and then how many, how much do you have? So the older you are, the more you have in your system. And so we compared by age, and we compared by females and males. And then we looked at those. There was only 20 people, because, we had limited resources. I know I wish I could say all the things we wish we could have done. But with those limited resources, we compared them to national data, because the U.S., the U.S. does measure dioxin in the general public. But they don't do it all the time, but we had the data from 2010 and 2011, I believe. And that's a while ago. But the levels here in East Palestine were either at or below what everyone else in the U.S. had in their body for dioxin, of those 20. And all of those people lived within a mile of the derailment. So I felt like, I was very scared. That's why we put a lot of effort into getting those dioxin tests done. It was a relief to see that it was not there. Now, should we go back to those people and do that again? I think so. Yes. Should we do it maybe even for more than 20? Yes. And then there's also newer data from national averages, so we'd have a more current and modern group to compare them to. So yes, we looked at it, but we need to do that again. So I'm glad you brought that up. And it's in our note, and we'll find the money to add that in.
I'll give you another list.
Okay, thanks. You're helping us spend our money. I love it. This is all for you. I love it's a catchphrase or whatever, but it's research with and for. It's with you and for you. So your comments are, you're kind of telling, how are we funded? I'm funded by federal dollars, right? And that's where the research money's coming from. It came from the NIH, which is funded by the government, right? And that's our tax money. So I'm going to say, because I am working now with these federal dollars, we all are, we're agents for you. We are, I'm going to say, public, servants. So you telling us what to do is the right thing to do. Keep telling us. We'll do it, if it's in our means.
I was just going to ask you about, okay, my doctor, he is a Mercy Health doctor at Bon Secours Mercy Health. I have gone round and round with them over everything that happened with the derailment and how my labs have actually changed over the past 2.5 to 3 years. I do this program at work where they give you an added little incentive. My labs have actually changed. I will give you whatever you want, but I don't think Mercy doctors will want to give out any information because they have been told from the beginning that the CDC, the EPA, everybody's saying, you don't need to get tested. We'll take care of you. They haven't done anything. And I just wanted to give you guys a heads up on that. And then I know I know a couple people where they have started getting like a Parkinson type over the past few years, shaking, and they are in denial. But the Mercy doctors are saying, oh, it's your medicines you're taking. So I don't know if anybody else is experiencing that. They're trying to label me now as a pre-diabetic, which I have not had any diabetes problems. I'm 60 years old now. And I've also started having AFib and possible SVT, which is supraventricular tachycardia. I have a cardia, those little cardia mobile things. I keep it with me at all times. So in case anything happens, and by the way, that started happening about 2.5 years ago. Isn't that amazing? I've had about 4 or 5 bouts of that by now. I've caught a few times on the cardia monitor. And that was just a few things I wanted to bring up to you to see if you can see if anybody else is experiencing anything else going on like that.
Well, hopefully you join the study and give that to
Oh,
us.
I have. I'm in
Great.
whatever study
Great.
you guys got. I've already
Okay,
done
good.
the fiber scan and
Good.
I did the
Let's-
blood work.
Julian,
I've
good.
done it a few times.
Okay, good. Yep. Yeah, I was going to say that. It doesn't matter if Mercy doesn't want to give them up. They're your records. And if you say give them up, they have to by law. They have no choice in that. It's your decision.
Believe me, I've had a number
of,
discussions while I'm at work.
Yes. And sometimes you do have to fight hard to get your records. And sometimes they make you pay for them. Like, anyway. Hospitals.
Well, I have the one thing, it's called My Chart. I don't know
Yeah.
if anybody else in here
Yeah.
has My Chart.
Yep.
You can look over all your blood records over the past few years, and you can see all your trends of what all your blood work
Yep.
is.
Yeah.
So that's just something to pass on to
Yep.
everybody.
Yep.
Okay?
Yep. Thank you.
Thank you.
All right, we were planning to add do you agree to release your medical records to us and then we will do that for everyone. And obviously it's voluntary. You don't have to, but we would love to have access and then add that information into the whole study. Because it's data we didn't have the luxury and privilege of collecting way back when, because maybe the hospital has it. Great. Other good comments, thoughts? Yeah.
I just received back my water well testing, got results back from my water well testing. Will you be getting any of that data from the well testing?
Yeah, we've added or wanted to add medical records, if you want to release those. And we've also wanted to add, if you have a well, would you be willing to release your well records to us? So that's great.
I didn't know if it
Yeah.
was just a county thing or.
Nope, we would love them. And in fact, we just have to find the best way to get them from you, because it's hard to upload things and documents, so.
I can bring them down to
All right.
what,
We will. We now have an office at the way station. And it can be collected there. Yes.
Yeah. Okay.
Done. Thank you. Love it. And thank you all for your openness and honesty about things you're experiencing. We really appreciate that. Any other thoughts?
Let's say you find a high-tech liver cancer, thyroid cancer, you find these problems in these human beings. What is your post-research plan? Are you part of that post-research plan? What's the action plan once data is received? 1 year, 2 year, 5 years down the road? Is that something to go back to the federal government for? Or is that,
Yeah.
what is the plan?
So, yeah. That's right. That's the big question. What do we do with that information? So, great question. We have our research role, but part of our role is to communicate that data, those facts, the things that we're seeing. So everyone who participates is going to get that facts, those data. The whole community will by community level fact sheets. We're going to work with the media so we can share it publicly. I think that's important, but then also taking it to those who are in power or in positions of power and decision that could enable an action. We don't have that position, but we will take it to them. Policymakers, we'll take it to the local health department. We'll take it all the way as far as we need to go. We will also communicate this and use it as a resource for the local healthcare providers. So if we see something, they need to be aware of it because they could be treating other people with the same. They need to know how to prevent. The more prevention, we know something, you can do more on the prevention side. So we're going to communicate it in many avenues. But then we'll probably need your assistance to help push the top issue. I've seen, I don't know, you guys were very successful at getting the government to give money to you as a community for this. I feel like there was a lot of action being done in the community. And I think Dr. Walsh was a part of that momentum. So seeing this happen gives me more confidence that there's hope. There's something that could be done. But that isn't the role of the researcher, right? But we will communicate it. Yep. And you have some great community members here who just beat on the front door of the White House, Misty, just for one. Your residents are up telling Washington, hey, look at East Palestine. We need you. Where are you? Yep. Oh, great. Thanks. I didn't know that, Lenny, on council. Yes. It takes all levels.
Okay, quick question. For this study, is there going to be any questions about lifestyle? Like, for instance, you live in town, you live by the railroad tracks, you've worked in a plant, you're a farmer. Does that have any effect? Like, you smoke, you didn't smoke, you're a welder?
Yes, we always have to ask lifestyle questions,
I mean,
behavior.
is that discrimination, or is that?
No, we can know.
part
We
of
can
this
ask you
survey?
that. It's a part of it. We look at
Because
smoking
a farmer might
history.
guess different than someone that
Yep.
lived right beside the railroad tracks.
Yep.
you know,
We're going to ask you for your address. We're going to ask you for very personal information, your birthday. We might send you a birthday card. Say, hey, happy birthday. We're going to ask you for your address. We also want your history of addresses. Where did you live when the derailment occurred? Where did you move after that? How often were you in town? We're also thinking about the occupational questions. What other exposures have you had in a workplace that, you know, we need to factor in? So yeah, we have an occupational component to this. It's going to be a lot of questions you'll have to answer. And we're just trying to put the picture together, put all the pieces together. Yeah. Any other questions? You guys are great. Yeah, go ahead. Keep asking them. Yikes, I didn't know about that. Oh, gosh. No. This is consent only. There's a consent form, and you have to sign it and agree. And at any point, you can say, hey, I'm done. Hey, I'm one out. This is all up to you and voluntary. I've never heard that. No. Oh, no. And in fact, I've never heard of that, so. Oh, geez. Okay. Well, we are not federal agents, so I would never do that to you. Wow. Geez. Yeah. Yeah. All right, we have another comment.
Yeah, I just want to respond to that, none of these studies are we actually experimenting on anyone. We're asking for data and information. It's completely voluntary. And also in response to following up on Erin's comment, you'll be able to answer parts of the survey if you want. So if you're like, I will give you this information, but I don't want to give you that, you can do that too. It's not all or nothing. But like no one in our studies are being exposed to anything at all. We're trying to find out what people have been exposed to in the past from these other sources, but no one's being experimented on. Yeah.
Great. Okay. I'd like to know more, because maybe I need a wristband. Yeah, send us that information, as I think I need a wristband. I need attending only tattooed on my chest, because I want the attending only to put the tube, yeah. Signed consent, oh, that's my only tattoo. Okay, Barb, when we go get tattoos together, that's mine. Attending only. Lenny, you're the tattoo. Okay. Oh, my husband's gonna hate you. Oh, yeah, IRB. So, yes. Our institutions, I mean, they watch us like a hawk. We can't do anything with the public and barely talk to you without their saying, okay, you're not going to harm the human that you're working with. So we're going through a very extensive, it's been, how long have we been in process with this, Tim? Months? Months trying to get the university to say, okay, what you're proposing to do on these individuals is okay. So it's called the Institutional Review Board, and it's just a process we have to go through. But it monitors what we do to make sure that you're safe, you're not harmed in any way, that we compensate you in fairly, that everyone's treated fairly, and we're not even selecting people to do things on. And many of this information came from trying to prevent war crimes and the treatment of Jews in Nazi Germany. Oh, yeah. And yeah, to the extent of what we have to go through to protect you, even our flyers, our fact sheets, they want anything we communicate to you to be approved by them. Just so you know the level of protection you have from academic work. Good.
So we do have time for one or two more questions or comments. Does anybody else who hasn't had a chance to speak yet have something they'd like to share with us before we start the documentary? Every one of these researchers is available, believe me. If you didn't get your question today or didn't feel like you could, answer or make a statement today because of the public forum, they are not out of reach. We can make sure you get a hold of them. They'll be around after, so if you want to share your contact information with them, we want to make sure that we get a hold of everyone who wants to participate. And we're hoping that you'll share with your friends, your neighbors, your family members, anyone here local, anyone who's in the surrounding communities. Symptoms or no, it is important that as many people as possible participate, do. We want all that data that's out there. So now that I've swiped the microphone, is there really anyone else that wants to share anything? We're absolutely happy to hear what you have to share. If not, so we do have a documentary. I'm going to grab my notes to make sure that I pronounce all names correctly. So this is a documentary that was put together through Daniel Rossi Keene and Riverwise. They've done actually a couple pieces here about East Palestine. So this one's going to be 10 or 15 minutes long. It's just a few short stories, some perspectives, but not all in total perspective. So again, this is another area. We want to hear from you. We really genuinely want to hear from people. And again, if you're not comfortable being in front of a camera, sharing your story, but maybe you know somebody else who would like to, or you feel like, Mr. Weber, your story is very impactful and it's something that needs to be shared, then please reach out. I know that he has an info sheet that also has that lovely QR code on it, but there are other ways to reach out if that's not something that you're comfortable with doing. Did you want to share anything? There you go.
Thanks, Jenny. Yep. Hello, everyone. As Cheney said, my name is Dr. Daniel Rossi Keene. I live in Beaver County, which is, I'm sure you all know, is about 600 feet, actually, from the derailment site. I have the privilege of working with a group of folks who have been helping to tell the stories of communities and residents who are trying to exercise greater control over the future of the places they live. We've been telling stories about that in our neighborhood and in our backyard for the last 8 or so years. So because of our proximity to the EP story, and also because of the nature of the story and the residents coming together to work to have better access to decision making and information and so forth, we really started shortly after the derailment to follow along with 10 or so different residents of East Palestine, of Beaver County, the surrounding area, and have been walking alongside them, patiently, slowly, capturing their unfolding story as it relates to the derailment. We've been piecing together over time a documentary called Still Here, Echoes of the East Palestine Derailment, and at the end of each year of work, we've put a piece of that out into the public for review. More recently, we've been honored to initiate a partnership with the University of Kentucky and the affiliated researchers here, really trying to figure out how best to convey this continuing, unfolding story surrounding the health research and the community's experience of that. We want to figure out how to do that well. It's one of the reasons we're here tonight. We're going to show you a piece of documentary that we've been putting together. I want to stress this is in process. This is incomplete. This is unfolding. No documentary, 5,000 documentaries couldn't capture the complexities of what you all have been through and continue to experience. So please take it in that vein as incomplete, but hopefully a soulful representation of the things that we've had access to over the handful of years. Part of what this attempts to do is really try to explain some of the importance of the research, the importance of community voices, and show how residents in small and big ways are calling for some of those things. So this is, in our hearts, this is the story of residents. This is not our story. We would love to figure out how to do that better, how to do that best, particularly in this context as it relates to the data, the unfolding scientific story, the research. And so we have flyers in the back. I know QR codes are the theme of the night. Scan one, send us in your ideas. We would love to talk with you. I do know we're going to capture Erin getting that tattoo on film soon. I heard her commit to that. So this is, again, an incomplete piece, but I hope you enjoy. Enjoy might not be the right word. I hope you appreciate, yes, hearing some of your neighbors talk about some of their experience over the years. So thank you.
Anyway, thank you all. Thank you so much. We're on this journey with you. We want to move forward with you. We want to monitor your health long term, and we're with you. So thank you so much, Riverwise, for making that. That was beautiful, and we look forward to many more. Thank you so much.
That's it. There's papers in the back. Grab them, get the resources, and yeah, pop into the way station. We're going to have stuff there. They're still working on the surveys, but those will be coming out soon, and we'll make sure we share that through all forms of media, print, social, news, the whole thing. Thank you, guys.